Hello, everyone, and welcome to another Advanced Rheumatology and Arthritis Research Center, Catching Up on the Couch. This is our first episode for 2023, and today I'd like to welcome Dr. Angela Stupi. Welcome, Dr. Stupi.
Hello. Pleasure to be here.
Happy New Year to you all. Today we're going to talk about Evusheld.
Correct.
And who should receive this, and what is it, Dr. Stupi?
Evusheld is our monoclonal antibodies. It's actually two different antibodies that the FDA issued for emergency use for people who would benefit with pre-COVID prophylaxis. And I emphasize pre-COVID prophylaxis because it is not really indicated to give to someone who has COVID.
Okay.
And it is not indicated and should not be given to someone who has had recent exposure to COVID.
Okay. So is this along the lines of a vaccine or like a super booster?
It's a prophylactic. It's a prophylactic medication to prevent COVID, and the people who would benefit most with it are those who are at highest risk for COVID. That includes anybody over the age of 65, those with diabetes or COPD or chronic illnesses that have a higher risk of being admitted to the hospital or having severe morbidity with COVID. And it's also indicated for people who are immunosuppressed.
Okay, like our patient population.
Like our patient population, yes. And then, and so it could be the disease that immunosuppresses them.
Okay.
Or it could be the medication that they're taking that can cause immunosuppression. And I think we have seen instances with some of our biologic patients whereby the patient did not convert following vaccine administration to mount the antibody response that they needed to for protection. And so in that instance, it would be important too.
Okay. So you're saying, especially our population over 65, what is the youngest that someone could receive?
12 years of age or older, and they need to be at least 40 kilograms, which is 88 pounds.
Okay. How do you get this prescribed?
Physician has to prescribe it, or a nurse practitioner or a physician assistant. They would have to write a prescription for this, and then the patients would be encouraged to go to a center where it's being distributed.
Okay. And we are one of those centers.
Yes, we are.
So what if the patient already received the vaccine and the boosters?
This is not a substitute for the vaccine first. Let me say that. Okay. If the patient has received the vaccine and booster, but we're concerned that they did not mount a response, you have to wait 2 weeks.
Okay.
And then you could have it administered. And it can be administered every 6 months if need be so.
Side effect profile?
Well, the most common side effects are headaches, fatigue, or cough. But we have some patients who could be at risk in receiving this vaccine. Now, it wasn't studied in depth because it was issued for emergency use. And so what we do have is when it was compared to placebo, there were increased cardiovascular events in the population of patients that received it, MI or heart failure. So if the patient already has these risk factors, they should probably not receive it.
Okay. You mentioned injection. So is this?
It's administered by injection, and it's 2 intramuscular injections into the gluteus, your rear end.
Okay.
And one is given, then the other is given right after that.
Okay. Is it a one-time thing, or?
As I mentioned, it could be administered every 6 months
Okay.
if need be.
Indefinitely, do you think, or more studies are
I
going
think
on?
we have to wait and see. Now, you also have to realize that it's protective for what has been out there now, but if more variants emerge, it's not going to be protective against those variants.
Okay. And you heavily research things that are out there before recommending them to the public,
Yes.
and especially our patient population.
Yes.
We treat so many different diagnoses here, and almost all of them are immunosuppressed.
Right. And also the patient should, if the patient has known thrombocytopenia, low platelet counts, or coagulation disorders, and many patients are on anticoagulants, we need to know that because there could be increased bleeding or bruising associated with the injection.
And so we would give this injection in the gluteals, or the rear end, as you said, here in the office, and then we would monitor the patient for an hour. Before letting them go. And this is billable to insurance. So it's not like it's a cash pay type of thing, and it's not like you can go to the pharmacy and receive it either.
That is correct.
Okay. Any last words?
No, I think that there are some people that probably should not receive this if they've had significant sensitivity to the COVID vaccine. This would be those people who are sensitive to the PEG, polyethylene glycol, because this contains polysorbate 80, which is very similar to polyethylene glycol. And so there are times that if they had a reaction to the vaccine, we would want them to be seen by an allergist or immunologist to clear them for the antibodies.
Okay.
And I think that we do not have enough data in pregnancy and lactation to administer it to those patients unless the risk outweighs the benefits. Keep in mind that the baby already has the maternal IgG antibodies for protection.
Okay.
But I think as far as pregnancy and lactation go, we would err on the side of not administering it.
Okay. And would you yourself consider receiving this?
I probably would if now I've been very up to date on my vaccines, and I have mounted an antibody response, so I probably would not need to, although if I were going to go in a very high risk population, suppose it's a social event that one is going to be attending, a wedding, a funeral, and if it's a high-risk situation, then I would consider getting the antibodies.
Okay. Any blood work needed before?
No, not necessarily. We have not done screening blood work, but if the patient does have a known history of low platelet counts, it's nice to know that ahead of time. That would probably not stop us from giving it, but we would take more precaution in, making sure they don't have increased bleeding or bruising.
Right. And you do treat every patient like a family member, and
I do.
You would recommend it to those that you feel, I know that we've discussed patients, that come to the top of your head that you really feel
need to have the extra protection.
And we do have patients that have received it in other offices and now want to come back here.
Yes.
But you've encouraged them just to stay with whomever was giving it to them in the first place since.
In the beginning, and if there has been a record, or if we have that record, then we probably can pick up and administer it from there.
Okay. And we're only administering to our patient population.
At this point in time, yes.
Okay. So, in closing, this is our first Catching Up on the Couch for 2023. It is not too late to get a flu shot. It is not too late to get vaccinated.
No.
COVID is still, I don't want to say rampant, but it's still on the move.
It's on the move, and it's probably increasing considerably now.
Do you have any concern of it becoming,
I think
a quarantine again?
I do have concerns, especially with what's happening in China right now. And so I think the administration has taken the policy of making certain that no one is COVID positive when they are transporting them from China to the United States. So it's probably a wise decision. Masking may become important again.
Okay.
And we still mask in our office here. We have an immunosuppressed population of patients, and we do encourage masking in the office because of the risk to those patients.
Yes, we do. So in closing, I want to thank Dr. Stupi for taking time out of her busy schedule to sit with us.
It's always a pleasure.
And we look forward to seeing you soon. Remember to continue to follow up in the office on a regular basis. We'd love to see you here, and you need to keep up with your blood work and other things in order for us to be able to continue to prescribe your medications. Dr. Stupi needs to see you to do a thorough exam of your joints. And moving into 2023, we're here already. We're really not quite sure what the insurance carriers have planned for 2023 regarding video visits.
It's being suggested that audio visits will not be covered and would become an expense to the patient.
Which we don't want.
We
have patients that come, a minimum of 10 minutes away up to sometimes 2 hours away. And we understand in the winter weather, we want you to be safe. But we also want you to stay healthy and follow up on your appointments. So we're going to sign off here, and we'll see you very soon. Our anti-inflammatory cooking classes are going to resume, and we always like to keep you up to date with what we have going on in the office, and there's plenty coming down the pike already. So stay safe, stay well, and we'll see you again soon.
Happy New Year!